Hi, I'm Dr. Randy Miles, and I am the Chief of Breast Imaging at Denver Health in Denver, Colorado. And I'm here to help you understand what to look for in your mammogram report. When looking at these reports, it sometimes can be very daunting just because there's so much information that's included in these reports. But I want to kind of help you identify those key elements that will help you and your doctor decide what to do next after reading these reports. The first thing that to look for is the breast density. There are four categories for breast density. There's almost entirely fatty, there's scattered fibroglandular tissue, heterogeneously dense, and extremely dense. If you have one of the first two categories that I mentioned, the almost entirely fatty or scattered fibroglandular tissue, then you are considered to not have dense breast tissue. If you have heterogeneously dense or extremely dense breast tissue, then you're considered to have dense breast tissue. If you're in one of those two dense breast tissue categories, there may be additional recommendations for additional imaging, just something that you want to look for in the report, and also something that you want to discuss with your doctor whether or not you should receive supplemental screening, whether that's with ultrasound or an additional modality, depending on your risk factors. The other thing you want to look for, and that's really helpful, is the impression and recommendation. So usually with the impression, there's going to be a very succinct um, summary about what was seen on your exam. It could just say normal exam, which is great, which means you probably can return for a routine screening in the next year. But if there is a finding, it'll be described, and with that impression, there'll also be a recommendation that corresponds to a BI-RADS category from 0 to 6. The important thing to know about that is not necessarily, what the numbers mean, but understanding that there is always going to be a recommendation for you after you receive these reports, and clearly looking for those and making sure that you perform the additional follow-up. If there's any questions about that, definitely want to contact your referring physician first. If there are persistent questions after that, then you want to contact the breast imaging center. So hopefully this helps you to understand what to look for in your mammogram report.